Post-traumatic stress disorder, PTSD, is a complex mental health condition that arises following exposure to traumatic events. Originally identified among veterans of the Vietnam War, the understanding of PTSD has expanded significantly since its inception. Today, it is recognized as a widespread condition affecting individuals who have experienced a variety of traumatic events, including but not limited to military combat, sexual assault, natural disasters, and severe accidents. The recognition of PTSD as a legitimate mental health issue has fostered greater awareness, research, and treatment avenues. In this video, we will provide you with a comprehensive overview of PTSD, its symptoms, causes, risk factors, and strategies for treatment. The nature of PTSD. PTSD is classified as an anxiety disorder, characterized by a range of symptoms that can severely disrupt an individual's functioning across various aspects of life. The condition may emerge in individuals who have directly experienced a traumatic event, or even those who have witnessed such events occurring to others. Significantly, PTSD is not limited to a specific demographic. It can affect individuals of all ages, genders, and backgrounds. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, outlines specific criteria for the diagnosis of PTSD. To qualify, an individual must have experienced symptoms for more than 1 month following a traumatic event, and these symptoms must result in significant distress or impairment in social, occupational, or other important areas of functioning. Symptoms of PTSD. PTSD is characterized by a constellation of symptoms that are generally grouped into 4 categories. Intrusive thoughts. Individuals with PTSD often experience intrusive, distressing memories of the traumatic event. Flashbacks can occur, during which the individual feels as though they are reliving the event. Nightmares related to the trauma are also common. Avoidance behaviors. Those suffering from PTSD may go to great lengths to avoid reminders of the trauma. This includes steering clear of places, people, or activities that evoke memories of the traumatic event. In some cases, they may also avoid discussing their experiences. Negative alterations in mood and cognition. Individuals may experience persistent negative emotions such as fear, guilt, anger, or shame. They might also struggle with memory problems, including difficulty recalling important aspects of the traumatic event. This can lead to a distorted worldview, affecting relationships and self-worth. Alterations in arousal and reactivity. Symptoms in this category may include heightened startle response, irritability, difficulty sleeping, and problems with concentration. An individual may feel restless or easily agitated, displaying an exaggerated emotional response to situations that remind them of the trauma. Causes and risk factors. The onset of PTSD is contingent on various interrelated factors, including the nature of the traumatic event, individual temperament, and resilience, and social support networks. Research indicates that while anyone exposed to trauma may be vulnerable to developing PTSD, certain risk factors may increase the likelihood of its onset. These factors include nature of the trauma. Specific types of trauma, particularly those that are prolonged or severe, significantly increase the risk of developing PTSD. For example, prolonged exposure to combat or chronic abuse tends to be associated with higher incidence rates. Pre-existing mental health conditions. Individuals with a history of anxiety or mood disorders are more susceptible to developing PTSD after experiencing trauma. Biological factors. Genetic predispositions and neurobiological vulnerabilities may also play a role in the development of PTSD. Research has identified alterations in brain structures and function in individuals with PTSD, which may contribute to symptoms. Social and environmental influences. The presence or absence of social support networks can significantly affect recovery. Individuals who lack supportive relationships or who have experienced recent substantial life stressors may face higher risks. The impact of PTSD. The ramifications of PTSD extend beyond the individual, affecting family dynamics, work life, and community relations. Individuals suffering from PTSD may experience difficulties in their personal relationships, struggle with employment, and find it challenging to participate in social activities. The emotional toll can lead to co-occurring conditions such as depression, anxiety disorders, or substance abuse, further complicating the individual's situation. Moreover, the societal stigma attached to mental health issues can hinder individuals from seeking assistance. Overcoming these barriers is crucial to facilitate recovery and promote mental health awareness. Treatment approaches. The treatment of PTSD typically involves a combination of psychotherapy, medication, or both, tailored to the individual's needs. The objective is to help individuals confront and process traumatic memories while developing coping strategies for associated symptoms. Psychotherapy. Several evidence-based psychotherapy modalities have been shown to be effective in treating PTSD. Among the most notable are cognitive behavioral therapy, CBT. This approach aims to identify and modify negative thought patterns and beliefs associated with trauma. CBT often includes exposure therapy, where individuals gradually confront trauma-related memories in a controlled and supportive environment. Eye movement desensitization and reprocessing, EMDR. EMDR is a specialized therapeutic approach involving guided eye movements while recalling traumatic memories. The technique facilitates the processing of traumatic experiences and diminishes their emotional charge. Trauma-focused cognitive behavioral therapy, TFCBT. Particularly effective for children and adolescents, TFCBT combines cognitive and behavioral interventions with a focus on trauma. This therapy involves both the child and their caregiver, facilitating a supportive environment for healing. Medication. Medications, such as selective serotonin reuptake inhibitors, SSRIs, and certain benzodiazepines, may be prescribed to help alleviate symptoms of anxiety, depression, and nightmares. However, medication is often recommended in conjunction with psychotherapy as part of a comprehensive treatment plan. Holistic and complementary approaches. In addition to traditional therapeutic methods, various holistic approaches have gained popularity. Techniques such as mindfulness, yoga, and art therapy can provide individuals with supplementary coping mechanisms. These practices foster relaxation, emotional expression, and self-awareness, further aiding the recovery process. In conclusion, post-traumatic stress disorder is a profound and multifaceted mental health condition that demands attention, understanding, and action. By unraveling the complexities surrounding PTSD, its symptoms, causes, risk factors, and treatment options, we can foster an environment conducive to healing and support for those affected. Greater awareness and sensitivity toward this condition can contribute to reducing stigma and promoting effective treatment resources. If you or someone you know is grappling with PTSD, remember that seeking help is a courageous step toward recovery. The journey, while often challenging, can culminate in resilience and renewed hope.